I'm going to call this meeting officially to order. Good morning and welcome to the first of 4 virtual meetings that the Great Lakes St. Lawrence Legislative Caucus is holding this year in place of our traditional in-person meetings. I know that we all enjoy our in-person meetings so much, and hopefully next year we'll be back to them. I'm from Illinois. My name's Robin Gable. I'm state representative and vice chair of the caucus, and I'm presiding over today's meeting. Our chair, Indiana Senator Ed Charbonneau, had a scheduling conflict, but he may come later this morning. The GLC is accustomed to web meetings, but this is the first time we're using Zoom. So I'll turn the floor over to Lisa for a brief technology refresher for anyone who needs it. Any of you are like me, we spend most of our days on Zoom, so I think this introduction will be brief. Here you go, Lisa.
Thank you. And yes, I know most people are experienced Zoomers these days, so I will keep it short. First, as we always do, we're recording this session and we'll make the video available later today on the GLLC website. And you'll all receive an email message from me when it's posted and you can access it. Second, many of you did receive a briefing book, virtual briefing book from me yesterday. If you didn't, or if you didn't see that message, look in the chat and you'll find a link to that virtual briefing book. We're going to be using this same link, the same book for all 4 of our virtual meetings. So if you're going to be joining us for future sessions, feel free to bookmark that link, and we'll be adding chapters basically for each of the individual sessions. And in there right now, you'll find the agenda, the speaker biographies, the presentation slides, and a whole bunch of other information on the caucus and on the topic of lead in drinking water. Since we do want to make this as interactive as possible and as most like an in-person meeting as we can, that's why we chose Zoom instead of our usual GoToWebinar format. So during the Q&A and the business session, feel free to share your video. It'd be nice to see people. Also, when you're using Zoom, you probably know this, but just in case, we recommend using speaker view just to view the speaker's video during the presentations. But then gallery view is nice to switch to if you want to see everybody showing video again later in the discussion when we won't really have slides. All lines should be muted while the speakers are talking, but you'll have a chance to ask questions, and you can do that in a few ways. You can either raise your real hand or your virtual hand in the participants section. You can type your question in the chat, or if you're on the phone and not viewing the presentation through the Zoom video, go ahead and email your question to me at gllc@csg.org. And here is the toolbar for those who need a refresher, just showing you where the various functions are. And then finally, if you're on social media and you decide to share anything related to today's session, we'd appreciate it if you'd use hashtag 2020GLLC and also mention us at GLL Caucus. Back to you, Representative Gable.
Great, thank you. Thank you for that refresher. So today we kick off our virtual meetings with a look at the contamination of drinking water with lead. And there must have been something in the water here, because just the other day in Illinois and Chicago, our mayor says that she's going to start addressing replacing lead pipes. So 750 out of 400,000, I think it is. Somebody said it'll take, half a century maybe to finish it all, but we're starting. This issue of lead in drinking water is a very high priority for the caucus, as many of you know, and we'll be hearing about the work of our task force on lead after the featured presentation. We're extremely grateful to the Joyce Foundation for its support of the GLLC's activities relating to lead, including today's meeting. I'm very pleased that we have with us 2 renowned experts in the field, Dr. Mona Hanna-Attisha and Elin Betanzo. The bios of these distinguished speakers are in the virtual briefing book, so I won't go into detail on their backgrounds, but please take a look. Suffice it to say that together, they expose the problem of lead in the tap water of the city of Flint, Michigan. The story of this discovery is featured in Dr. Mona's book, What the Eyes Don't See, which was a New York Times notable book in 2018. If we were meeting in person, I'm sure many of us would be standing in line after the presentation to speak with Dr. Mona and to buy an autographed copy of her book. Today, we'll hear first from Dr. Mona about her ongoing research into the long-term health impacts of lead poisoning on the children of Flint. Afterwards, Elin will talk about state, provincial, and federal policies to address lead in drinking water. I'm particularly excited to hear her assessment of the model policies that the GLLC's own task force has developed. Thank you both for your work and for lending us your expertise today. Dr. Mona, you have the floor.
Awesome. You guys can hear me? Thumbs up. Good. All right. I loved seeing those thumbs. It is great to be here with you. Likewise, I wish it could be in person. I am absolutely a people person. I'm a hugger, a high fiver, a fist bumper. I love to make eye contact, but you know, this is the next best thing. So thank you for this opportunity to connect with all of you. And I'm so excited to do this with Elin, who is a longtime high school buddy. And I kind of want to share a little bit of our background because it really reflects on what you are all doing and the importance of your roles as Great Lakes policymakers. So Elin and I met almost exactly 30 years ago as high school freshmen. We went to high school together and quickly became involved in environmental activism. There was an incinerator in an adjacent city that was about to reopen, and our high school environmental club kind of bravely went out and worked on a local real issue. And we would door knock, and we went to Greenpeace protests and tried to advocate for the ongoing closure of this incinerator. And it wasn't going well until we finally worked to elect a state representative to the Michigan legislature. So somebody who had been working on this clean air issue with us. And the very first thing he did when he got to Lansing, our state capital, was pass a law that you couldn't operate an incinerator so close to a school. It was literally in the shadows of an elementary school and a senior center. And the incinerator closed. And to this day, it has never reopened. So from this kind of really early age, I know it was a lesson that, you know, was taken home to me and Elin and so many other of us who were part of that work. We learned about the connection between environment and health. The kids in that neighborhood had higher rates of asthma, higher rates, the adults had higher rates of COPD or respiratory disease. It was also a poorer neighborhood, so we started to learn early lessons of environmental injustice. But for me, most importantly, I learned about the role of policymakers, how when policymakers truly respect science and serve the public, they can make profound differences in the lives of their community. So that very early experience made me a strong believer in government and in the role that our policymakers can have to improve the lives of its residents. So thank you to all of you for doing that work every single day, for creating policies, for working in a bipartisan way to ensure that our work to protect our communities and especially our most vulnerable populations is at its priority. And I would be remiss to say that kind of activism in high school didn't shape many of us. My brother went on to become a public interest lawyer. Another one of our classmates went on to become a state representative. And another one of our classmates is here, Representative Rachel Hood was also one of our classmates. So I don't know what was in our water at that time, but we were all shaped by those really early experiences. And I'm so proud of her and what everybody has done in this respect. So that's kind of a little bit about kind of how I got to be where I am, and that environmental activism also afforded many opportunities when I was quite young to do things like this. I remember as a high school student going to an IJC conference in Windsor and learning about how important it was to collaborate with our international partners. So it's also great to be part of this meeting where there's folks from not just the states and the surrounding Great Lakes region, but also the international community who care about the same things that we do. So now I want to get into the Flint story. So after kind of that high school environmental activism. I went on to study environmental studies at the University of Michigan in what was then called the School of Natural Resources and Environment. And then quickly kind of got excited about the field of environmental health, did a lot of research, bench research, and things like reproductive toxicology and how certain chemicals can impact the human body and the lives of individuals that are disproportionately impacted. Went on to medical school, became a pediatrician, also got a public health degree in health policy. As much as I love caring for one child at a time, I also realized how important it is to do work at that population level and address the upstream determinants of how our, of what impacts our children and ultimately their health outcomes. I acutely understand that medicine only contributes about 10 to 20% of the outcomes of individuals. It's all these other things that we call in medicine and public health, the social determinants of health, that really can play a greater role in the lives of our children. And those things include environmental contamination, school conditions, poverty, racism, access to nutrition. The list goes on of so many toxicities that can be in a child's environment that impacts how they end up. And because of that, we're increasingly recognizing the role of geography and even zip codes and census tracts. For example, in Flint, in our county, within 2 parts of the county, you can have a 20-year difference in life expectancy. And that's throughout this country, where you live is often the greatest predictor of where you end up because of these environmental conditions that impact the lives and the trajectories of our children. And it was really kind of early in my career where I had really the privilege and the honor of learning from some of the founders of the environmental justice movement at the University of Michigan, Bunyan Bryant and Paul Mohai, who taught me 25-ish years ago that lead was a form of environmental injustice, that lead was a form of environmental racism, that even back then it was something that disproportionately impacted our most vulnerable populations. As I progressed through medicine and public health, I began to really understand the science of lead and what lead does. Throughout my training and my career, earlier we used to think that, certain levels of lead were okay in our environment and in the bodies of our children. But over the last few decades, we have come to respect the incredible science that now recognizes that there is no safe level of lead. And this is consensus from the CDC, the Centers for Disease Control, the American Academy of Pediatrics, the World Health Organization, that there is not a level of lead that has been shown to be safe for children. So how did we get to this consensus? Through lots and lots of research, lots of studies, lots of epidemiologic research, lots of bench research. What lead does to a child is well known. It impacts cognition, literally how kids think. It impacts behavior, how kids act. It leads to things like developmental disabilities, attention problems, focusing problems. Childhood exposure to lead can be manifested later in life. For example, a young child exposed to lead can present as an adult or a senior with high blood pressure, hypertension, or early dementia. So it has these long-acting consequences, insidious. In pediatrics, we call it a silent pediatric epidemic. Unfortunately, the exposure to lead and the symptoms of lead are quite invisible. We don't acutely see them. Back when I was a trainee in Detroit, we always had patients admitted to the hospital with lead poisoning, like super, super high levels where they had to undergo medical therapy and chelation, and they were at risk for seizures and coma and death. That was the kind of a few decades ago when we had higher levels of lead. But now it's almost worse because now we don't see the acute symptoms, and we don't know when a child is being exposed to lead. Yet the consequences present years, if not decades later, and impact their education and their economic productivity and their job attainment, and the list goes on and on and on. So because of what lead does, we have gotten to this consensus point of recognizing that there is no safe level of lead. And in the field of public health and medicine, we're supposed to practice something called primary prevention, which means that we're supposed to do everything we can to not expose a population to lead. So the focus really should be on finding and eliminating lead in the environment, especially of our most vulnerable populations, especially in those populations where there might be at-risk children. So finding it, eliminating it before we ever test a kid and find lead in their blood. Because when we do that, we are literally using children as detectors of environmental contamination. Because if something has no safe level and it's potent and it's irreversible, and we find it in a child's blood, it's too late for that child. The focus that needs to happen at a systemic level needs to be screening of environments before children are ever exposed. So I respect and acknowledge and understand the science of lead, that it is a potent, irreversible neurotoxin. I also understand its disparate impact. Flint kids, just like Detroit kids, just like so many kids in certain Milwaukee kids, Chicago kids have higher rates of lead exposure for many reasons, because of poor housing conditions, poor nutrition, long-standing and historic racist real estate practices and redlining. The list goes on and on of why there's disparate populations. So even though children's lead levels have come down over the last 30 years because of the elimination of lead from paint and gasoline, the legacy of lead exposure persists. It remains hidden under layers of paint. It remains underneath soil because of previous gas deposits, and it remains part of our drinking water infrastructure. So even though we have better policies, even though they were albeit late in coming to eliminate lead exposure or to decrease lead exposure, we still have certain pockets of children that are exposed, and very disparately. There's census blocks in Detroit that have about a 25% rate exposure. So once again, knowing the science of lead, and now you all know the science of lead, and it would keep anybody up at night knowing what lead does. If you wanted to put anything in a population to keep them down, to keep them oppressed, to keep them suppressed, to limit their opportunity, it would be something like lead exposure. So when you understand that, and when you understand the disparities, for me, there was kind of a moment that changed my life in the Flint story in regards to lead. And it all happened with Elin. So Elin, who you're about to hear next, like I said, is a high school girlfriend. We've been able to keep in touch over the last 30 years. She had been working in DC for several years, working at the EPA, this expert in drinking water, and was at my home in the late summer of 2015 when our children were playing, and it was great to reconnect. And it was then in my home where she cornered me in my kitchen and shared that the Flint water wasn't being treated properly. It was missing this ingredient called corrosion control, which I'd never heard of before then. And she shared that because this ingredient wasn't in the water treatment, then there would be lead in the water. So that was the exact moment that my life changed, thanks to Elin, for sharing, about the possibility of lead in our water. And I think all of you would have had your lives changed if you had heard the same, when you now understand what lead does and what it does to the potential of our children. So here were our Flint kids who were already suffering so many toxicities of life. We have like a 60% child poverty rate. We have no full service grocery stores, high rates of unemployment and disinvestment, long-standing toxicities, and under emergency management and in a near bankrupt state. And now there's this potential of population-wide lead exposure. So that was kind of what pushed me to see what was happening with our children, and then to publicly share that, and since then have been working on our recovery in Flint. So Let me kind of get a little bit to kind of the recovery and where we are right now. So I wish I could prescribe like a magic pill to take away what happened in Flint. So like that would be amazing if there was like this magic antidote, but there's not, remember, because there's no safe level. It's potent, it's irreversible. You can't take it away. So recognizing that we failed at primary prevention, our next step became secondary prevention, which in public health means, hey, you have a population of folks that are exposed to something, but they might not have symptoms or consequences right now. What can you put into place to mitigate, to limit, to buffer the impact of that exposure? So we definitely leaned on the science of lead exposure, the science of child development, the science of kind of brain plasticity and early adversity, to put into place interventions to promote the health and development of our children in Flint. So the things that we've been able to do, and this is really leaning on kind of the science of child development. And, you know, you can think of Flint so much of a story of like what happens when you don't respect science. Ultimately, it was science that was able to speak truth to power and help expose this crisis. And once again, we are leaning kind of on science in our recovery. So things that we've been able to put into place really span the domain of education, nutrition, and healthcare. So education, it's been a lot of work around in early childhood education. We have 2 brand new childcare centers, lots of literacy support. We're part of the Imagination Library program. Every kid in Flint gets a book mailed to their house every month. We do lots of parenting support. Home visiting programs have been expanded. School health services. Before all this, Flint had 1 school nurse, and we were able to expand the number of school nurses. So education, nutrition is critically important in lead exposure. Children absorb more lead if they have poor nutrition, if their stomachs are empty, if they're deficient in certain nutrients like calcium, iron, vitamin C, they absorb lead more readily. This is one of the reasons that we have disparities in lead exposure because of poor nutrition of children. So a lot of our work has been around nutrition, expanding opportunities like in WIC and school lunches. We do nutrition prescriptions in our clinic, summer feeding programs, backpack programs, kind of the list goes on of efforts to improve nutrition, still obviously not enough. And then other efforts around health, access to the medical home, to primary care providers, to neurodevelopmental assessments, to mental health care, trauma-informed care. A lot of what we're seeing are really kind of behavioral health and trauma-related consequences of this crisis. One of the key ingredients in our recovery has been something called the Flint Registry. It's funded by the CDC. It's an effort to identify folks that were exposed to the crisis, and most importantly, get them connected to the resources to improve their public health. So it's public health infrastructure. It's not research. We've actually been designated by the CDC as a public health authority. We connect folks to Medicaid expansion and to childcare and to parenting support and to nutrition and the food bank, and the list goes on and on. So we've been able to build this public health infrastructure to support families, and through that registry it really lives our data-driven efforts to help answer the question of how is Flint doing? I think that's probably the most common question I get asked, like, how are the kids doing? You know, how is Flint doing? And I can tell you about the patients I see in clinic, but that's not what you want to know. You want to know how the population of children is doing. So we're starting to get early results of that population level information. About 30,000 plus people have signed up for the registry. Thousands have been referred for in-depth neurodevelopmental assessments. And what I can share so far is that there are significant concerns, ongoing concerns related to health, development, behavior, cognition. Of the first 200 kids that had in-depth, like 8-hour neuropsychological assessments, over 80% had some sort of deficits. It's not my job to tell anybody that this is kind of from the exposure. That's really hard to prove causation. My job as a pediatrician is very much to support families moving forward and to support the children to mitigate this impact. So, you know, when you're dealing with something like lead, you have to understand the long-term, decades-long implications and the economics of prevention. after Flint, there was a great report that came out from the Pew and the Robert Wood Johnson Foundation that looked at the economics of lead elimination. So often we hear, oh, we can't replace the pipes, it's too expensive, and we can't abate homes and get the lead out, and we can't clean up the soil. But it actually really makes really strong economic sense. If we did work on lead elimination, where we replaced those lead service lines and we cleaned up homes, it would save our nation $80 billion a year. When you look at special education costs, healthcare costs, criminal justice costs, and decreased economic productivity. So it also makes economic sense to do this. And there's some really great state level analysis that is also happening in this respect. Elin and I are also specifically working on a project now looking at the economics of Michigan's lead pipe replacement program. And, you know, a lot of the concerns in the beginning were like, this costs too much, we can't afford this. But, you know, in the early analysis, and that's not complete yet, it also shows that it has an economic benefit when we do this, when we incorporate all these long-term societal costs. So, you know, I think, something I was chatting with earlier with some folks is, you know, we're in bizarre times right now. We're in the midst of another public health crisis that for me eerily feels so much like Flint. And as an eternal optimist, I'm kind of actually excited that so many folks are learning the same lessons that we learned in Flint. In Flint, some of our biggest lessons that included the importance of good governance that values public health and science. Our take-home lessons also included the need to really respect science and facts and have that be the driver. We also learned that we need to proactively invest in public health and public health infrastructure, be it drinking water or surveillance programs. And in Flint, we also learned about the importance of disparities because, you know, Flint never would have happened in a different kind of community. These are the same, almost exact lessons that we're learning in this pandemic. The importance of good governance, the need to respect science, the need to proactively and fully invest in public health, and the important role of disparities and injustices and inequities in certain populations. So for me, these all present as opportunities. And opportunities to finally learn a lot of these lessons. And rather than kind of cut back on everything that we're trying to accomplish, I think it's our time to really invest in public health and invest in this work that has been put off for so long. And I want to end with, before I pass it on to Elin, I want to end with a quote. So, you know, we've been dealing with lead for centuries. This is not a new thing. Flint wasn't the first lead and water issue. There's been lead and water issues for quite some time. There's actually theories that hypothesize the demise of the Romans is because they used lead plumbing, and they also put lead in their food, which was not a good idea. But if you go to places like Pompeii, you can actually see the lead pipes. But we've had lead and water issues throughout time. And we've been dealing with kind of lead poisoning throughout time, and we've been minimizing the science and putting doubt in the science and really minimizing the populations that have been impacted. So I want to read you one of my favorite quotes. It's from 1969 by a scientist named Rene Dubois, and he was talking about the persistence of childhood lead poisoning. And he says, "The problem is so well defined, so neatly packaged, with both causes and cures known, that if we don't eliminate the social crime, our society deserves all the disasters that have been forecast for it." 1969. I think it's past time that we take action. So thank you. Once again, I'm super excited to be here with you. I'm happy to pass it on to Elin and happy to entertain questions later.
Hello. Am I putting up my slides, or is...
No, Elin, Jenny will show her screen.
Okay, that's what I wanted to make sure. So thank you, Mona. Thank you for that introduction and going over all of the health background here. I'm going to be talking about the model policies that the Great Lakes St. Lawrence Legislative Caucus has put together for reducing exposure to lead in drinking water, and kind of a status of where we are in the region for getting those policies implemented. So on the next slide, I've got kind of a little overview here. What I saw in the model policies that you have developed, it's an excellent package for removing lead service lines and reducing lead exposure. It's absolutely has to come as a package of recommendations and requirements, because we have the 1991 federal lead and copper rule here in the United States, and it has not been very effective for removing those lead service lines. Lead service lines are like a lead straw that you draw the water through into your house. So every drink of water you get in a house with a lead service line has a risk of lead in it. As Mona said, there's no level of safe lead exposure, and so any glass of water could have lead in it if you've got, especially if you have a lead service line, but we also have lead in our plumbing as well. So in the model policies that you've got there, it starts off with an inventory. We absolutely need to have service line inventories. We have to know where those lead service lines are in order to replace them. And it's important for it to be a comprehensive service line inventory. We should know what all the materials are. We don't need to just limit it to lead. If we're taking an asset management strategy for water systems, we need to know what all the service lines are made of and keep that information up to date. So if there's ever a problem in the future with a different pipe material, we don't have to repeat this all over again. So when we have an inventory, it should be an ongoing inventory recommendation and requirement. You've got the recommendation in there to replace all lead service lines over a period of 20 years or less. So yes, with the 91 lead and copper rule that encourages lead service line replacement, it did not accomplish that. We still have 6 to 10 million lead service lines in service throughout the country. A very important policy that you have recommended that is absolutely critical is ensuring that community water systems are authorized to pay for and replace lead service lines that are on private property. In the past, it's been a focus of just replacing lead service lines that are on public property, and that results in partial lead service line replacement, which actually increases the risk of lead exposure in the home. And it is particularly an issue that affects low-income residents, renters, Black and brown communities where they cannot afford replacement on the private side, and some of these older policies that have allowed partial replacement increases the exposure for our most vulnerable residents. So I love the fact that you have included that in your model policy here. And the funding of the replacement through loans, grants, and rates, it's going to have to be a combination because we have so many lead service lines in the Great Lakes region. So on my next slide, I've got kind of a snapshot of where we are today in the Great Lakes states of implementing these recommended policies. So right now, Michigan has a revised lead and copper rule, a regulation that includes a requirement to remove all lead service lines within 20 years. It also includes a ban on partial lead service line replacements. And so for removing all the lead service lines, that's the only state right now that has that requirement. So both in the Great Lakes states and nationwide. There's a bill introduced in Illinois, but that has not been passed yet. We have several states that have revised their requirements to make it clear that lead service lines can be replaced on private property. So we have that now in Michigan, Indiana, Pennsylvania, and Wisconsin. Again, Illinois has that bill introduced. The service line inventories, as I mentioned, is the foundation of any effective program for removing lead service lines and notifying residents of their risk of exposure to lead in water. So Illinois and Wisconsin have very strong inventory requirements, and they have to report annually on their updates to that service line inventory. Michigan took a slightly different approach to this. In Michigan, water systems have to do a preliminary inventory, and that was due in January this year, and then they have 5 years for a complete inventory. It's not necessarily an annual update as Illinois and Wisconsin. Ohio has a requirement to map the areas with probable lead service lines every 5 years, so it's not quite as rigorous as the others. And then Indiana did a one-time voluntary service line inventory. We have several states that added funding for lead service line replacement, but the investment was very different across the different states. But I saw those programs in Indiana, Minnesota, New York, Pennsylvania, Wisconsin, and Michigan. And as Mona was talking about those cost-benefit analysis, Minnesota did its own cost-benefit analysis of lead service line replacement and found that if $4 billion were invested in lead service line replacement, there would be $8 billion in benefit. So a 2-to-1 ratio there. It's a pretty good investment when you know what we're doing for the children and our next generation. In the model policies, there's a recommendation to reduce the action level for lead in water. Michigan has taken that move by reducing the action level from 15 parts per billion to 12 parts per billion. In 2025, again, 12 parts per billion is not a level that's protective of public health. And the way we do that in the lead and copper rule in the United States, that is an indicator of corrosion control effectiveness. It's not a health protective level. Canada takes a completely different approach to this. They've established their health goal reduction to 5 parts per billion. And so that's under a very different regulatory structure, and that 5 parts per billion has a different role, but that is much more in the range of being protective of public health than that 12 or 15 that we use in the United States. So then on my next slide, I'm going to get into school drinking water. And in schools, we have our youngest children in childcare in schools, and we have a risk of lead in drinking water in schools because we have lead throughout our plumbing, and schools have irregular water use patterns, and corrosion control doesn't work as designed. Corrosion control needs regular turnover, regular water use for it to work as intended. So we know that there's lead in schools, especially in the schools where all the plumbing was installed prior to 2014, when we had the most recent update to our lead-free requirement for plumbing. And so my recommendation for school drinking water is to take a filter first strategy where we focus on providing safe water now and then following up with sampling to ensure that the filters are performing. When we take a sampling first strategy, that means we're taking time to do the sampling, let it show up, and then we're just delaying that response, delaying the ability to provide safe water. So my preference is safe water now, and then follow up to make sure that those filters are performing. So what I call a filter first strategy with these water bottle, filtered water bottle filling stations like we have in some of our schools here. It's important to know that lead release is sporadic. A single one-time test does not reflect the risk of lead release from a single tap. And this means that when you do a sampling program where you're only taking one sample at one tap a year or once every 5 years, that does not reflect the risk of lead exposure there. My own children's elementary school just down the street from my house, a sample 1 month was non-detect, and then the next month was 140 parts per billion. So that's not a strategy for providing safe water right now. And so just a reminder that the American Academy of Pediatrics recommends an action level of 1 part per billion. So this is the strategy that I prefer to take. However, on the next slide, I've got kind of a summary of where we are in the Great Lakes states. Michigan has introduced a bill for the filter first strategy for schools and another one for child care facilities. So this, there's a chance that that might pass during this session in Michigan. But the majority of the Great Lakes states have taken the sampling strategy. So a focus on providing information and perhaps not so much a focus on providing safe water in schools and child cares. So a variety of strategies here between mandatory and voluntary sampling and different action levels and different remediation responses. So Illinois had a one-time sampling effort with notifying families if lead is over 5 parts per billion, but no remediation was required. So information, but not safe water. New York sampling every tap once every 5 years. As I said, lead release is sporadic. That's not going to identify all the lead risks, and they're only required to remediate over 15 parts per billion. Again, American Academy of Pediatrics, 1 part per billion is the recommended action level there. So then Pennsylvania took a different strategy. They recommend annual sampling. It's not required, but if they choose to not do the annual sampling, they must discuss at a public meeting the fact that they didn't sample. Ohio and Wisconsin have voluntary programs. Michigan had also introduced a testing bill and has a voluntary sampling program. In cases, child care facilities has been handled a little differently. Illinois has a much more aggressive program there for child care with our youngest and most vulnerable residents. They must sample every year until 2 consecutive tests show no lead, and their action level is 2. So that's much more in the range of providing protection there. Wisconsin introduced a child care testing bill that didn't pass, and Michigan introduced a testing bill, but the focus in Michigan again right now is on that filter first strategy. So then on my next slide, there were just a few more things I wanted to update you on, national scale lead updates to be aware of and how we implement policies in our states. The NSF 53 standard, that's our standard for how filters operate. So the standard for lead reduction has been revised to be more protective. So over the next few years, those filters will be certified under that new standard and be more protective. Last year, the filter effluent had to be guaranteed to be 10 parts per billion, and now it's down to 5 parts per billion. So as a short-term intervention, or for those filters that we have in schools where the higher quality water is coming out of those filters, although many studies have shown that filters are effective for bringing most water down to a non-detect level for lead. NSF 61 is our plumbing standard that certifies that plumbing materials are safe for drinking water. They've revised the lead leaching standard. Right now, our definition of lead-free plumbing is up to 0.25% lead by weight. So lead-free plumbing actually by definition includes lead. That's why when we replace fixtures in schools, we're putting new lead into those plumbing systems. But there is a new lead leaching standard. So over the next few years, as more devices are certified to that standard, even though they have up to 0.25% lead by weight, they will leach, they will release less lead. So if you are looking at replacing devices in schools and homes, making sure waiting until that new lead leaching standard is in place would be a great investment to make sure you're achieving low lead in those fixtures. EPA just finalized their rule that codifies the lead-free standard, that 0.25% lead. And in this new rule that was just finalized, I think it was August 31st, requires that those plumbing materials meet that NSF 61, which will be phasing in that more stringent requirement. So both of those pieces together are really going to improve our ability to install lower lead devices in our homes and schools. And EPA is expected to finalize revisions to the federal lead and copper rule this fall, possibly this month. Now, just wanted to touch on coronavirus and water quality, because this is a hard-hitting, immediate need right now. When we've had our coronavirus shutdowns, especially in schools and buildings, it increases the risk of lead and bacteria in stagnant water in schools and workplaces. Schools are overwhelmed right now with all of the decision making. They are trying to work virtual school, face-to-face learning, getting their buildings operating and trying to keep things as normal as possible for students. So making sure that they have easy access to information about their school drinking water is critical. They need to keep the water moving in schools to reduce the lead release into the water and to reduce the risk of bacteria. Legionella has been detected in multiple elementary schools in Pennsylvania. There was just an article in the New York Times about this. So schools need guidance now for flushing their water, keeping the water moving. If they leave the water setting still, they're going to have plumbing issues and infrastructure failures in those schools. And especially if they have staff in the school buildings, but not students, that means they have decreased water use. They need supplemental flushing to keep that water safe. We've got water shutoff moratoria, water restoration orders in several of our Great Lakes states. And it's important to keep in mind that when you shut the water off, you're increasing the risk of lead in that water, because when the water doesn't move, the lead starts to leach and the corrosion control reduces effectiveness. And hopefully we'll get some stimulus bills and some more pandemic response bills at the federal level, and several of those bills that have been introduced do include targeted funding for lead service line replacement. So hopefully we'll see some of that in our future. And I have a slide in there for resources for you that I hope you'll click through if you're looking to notify school buildings and other buildings that are reopening about water quality issues there. So thank you very much for being able to share this information with you.
Well, thank you. Thank you so much, Elin and Dr. Mona. I really, really appreciate your presentations. And we have some time for questions now. I just wanted to start by saying that since you've noted that infants are probably the most severely affected by lead exposure, but yet their symptoms don't appear till a little bit later, we passed a bill in Illinois that I sponsored that says that any child who has high lead levels, any young child, automatically qualifies for our early intervention program. So we don't have to wait till they have symptoms, but you can start addressing the issues that they may have now. So that's
awesome.
Yeah,
that's awesome. I think I worked with one of the pediatricians that helped do that in Illinois. That's fantastic. That's something that we were also able to do in Flint, provide universal early on, which is early intervention in Michigan. And it's really important to do this before the symptoms present, to provide developmental support, because when the symptoms present, it's too late. And if I could answer one of the questions that's on the chat that kind of relates to the ages. So lead exposure is worse for the younger children because it's a neurotoxin. It attacks the developing nervous system. And this is kind of where I want to bring home a little bit about the difference between lead and water exposure and lead paint exposure, which hopefully tries to address Senator Bizon's question. So lead, what we're used to in medicine and public health and what we're trained to do is really think a lot about lead paint. Lead paint, lead paint, lead paint, lead paint, lead dust, lead soil. And that's kind of, that was always kind of what we used to consider without knowing that you could also have lead in water. And their surveillance systems for blood lead monitoring were built on detecting lead paint exposure. As pediatricians, we screen children for blood lead levels. It's different in every state. It used to be universal, but by and large, we screen children at the ages of 1 and 2 years, because that's when children are crawling, they're walking, they have a lot of hand-to-mouth activity. They're developmentally at risk for lead exposure from the household, paint chips, dust, soil. And it's a surveillance program, once again, designed to pick up household lead exposure, not lead and water exposure. Lead and water exposure impacts a different age group that is not represented by the blood lead surveillance programs. Lead and water impacts in utero populations, so it impacts the unborn. It's known to have maternal fetal implications, including fetal death. One of the first abortion pills in England in the late 1890s was a lead-based abortion pill. It also causes prematurity and small birth weight. So it crosses the placenta. And then it also impacts especially younger infants on formula, and formula, as many of you know, is made with powder and water, and usually reconstituted tap water. So these kids could have their greatest risk of exposure at a period where they're most vulnerable, where their development is rapidly progressing, and it can have kind of an even longer life course trajectory impact. So it's a different age group of exposure, and please know that blood lead surveillance monitoring does not detect a lead and water exposure.
And I guess if I could just add to that, the homes that have a lead paint issue are also the homes that would have higher lead in the plumbing. So if you have detected a child with a lead paint, lead dust exposure, eliminating all sources of lead exposure is that much more critical. So if you are going into a home to remove the paint, you should also be removing the lead service line and making sure that all of the lead solder in the plumbing connections and the faucets are all the newest lead-free faucets that are available.
Yeah, there's not one source of lead that is worse than the other. They're all bad. And historically, we've tried to have competing arguments. The water people be like, oh, the paint is worse, like attack them. And the paint people are like, oh, the water is worse. It's all bad. And we have to respect that science, and we have to work towards prevention.
This is Lisa. We're getting close to the time to wrap up, but I see that Senator Ann Rest has her hand raised. So Senator Rest, you want to unmute your line and go ahead and ask your question?
Thank you. When you were showing the chart about what the different states are doing, and it's clear that there's no consistent standard, either that would either require remediation or not. And I was wondering, is there an explanation about why there's so many different standards? 5 parts per billion here, 15 here. Minnesota has 20, which is pretty high. Is it because these standards were passed at different times, so that the stricter ones came about because of more information, even though 0, as we know, is the only acceptable level. But I was just wondering if there was a progression in the science about what was really needed at different times, rather than what might be considered political decisions of, well, what can you get past? And is it science or politics that are driving the standards? And I don't mean politics in a bad way. I just mean negotiated bills. Do you have any response to that?
Yeah, so I think it was just in March that Indiana passed a school sampling bill with an action level of 15 parts per billion. So that is the most recent one, and it's maintaining 15 parts per billion as its action level, which we know is not protective. And part of that originates with the federal lead and copper rule, with this action level that's really been misrepresented as a safe level of lead, and it's not. There's no health expert who would ever say that 15 parts per billion in our water is safe. So it starts with the federal lead and copper rule. EPA did have school sampling guidance out for a long time that actually used 20 parts per billion as its action level for schools. But they did take that down 2 or 3 years ago. So that kind of helps explain why we've moved to 15 and not 20. But really, having that federal action level at 15 parts per billion has really confused the conversation around lead in drinking water. The American Academy of Pediatrics recommends one. I often think about 5 parts per billion as a very implementable, making sure that we're getting below 5, because we know that filters now will get us below 5, and the bottled water standard is 5. That's a much more reasonable place to go, but not going there with the sampling, providing the safe water first, and then doing the sampling afterwards to make sure that we're keeping below 5. But that's kind of how those different levels have come into being.
Well, the Great Lakes Legislative Caucus Task Force on Lead, it seems to me that what we did in our model policies and whatever was to kind of take a middle position rather than accept one science over another. And I think we probably, our task force should probably review that particular part of our policy statements going forward. So thank you for that.
This is
comparison.
This is
really
Lisa.
in front of
I'm
us.
sorry, Senator Rest, I'm going to break in just for a second because we do have a lot of questions and I want to be able to get to them. But first I need to find out if Senator Vanderwall is able to stay on a few minutes after the hour since he's giving the Task Force on Lead report.
I sure am. I plan on being on.
Okay, excellent. Then we'll go with, I saw some actual hands
I'm
raised.
sorry, Lisa, I didn't see that, and I'm looking forward to Kurt's presentation.
No, that's fine. Your question was very good. I saw MPP Jennifer French had her hand raised, so we'll go to her next. I think Senator Janet Peterson has a question and we can read it, or you can unmute your line when MPP French is done, and then we'll go to Representative Earl Harris Jr. from Indiana.
Thank you, Lisa. And ladies, thank you very much for the presentation. I also have the opportunity to serve on the task force, the anti-lead task force with a number of my colleagues on here, and Kurt is going to get us up to speed. But one of the conversations that we had at some of our meetings that I thought was interesting, and Elin, you mentioned it, when it comes to replacing lead pipes with non-lead pipes, it kind of blows my mind that non-lead pipes indeed have a low limit or whatever of lead. Do you guys have any recommendations for what needs to happen to ensure that the pipes that are replacing the lead pipes indeed are safe? Is that an industry pressure? Is it that there's no available, lead-free piping? And I think the answer to that is, of course, there is. So I'm curious to know, and I can't speak to what's happening in Canada, but I'm wondering, at maybe the legislative side of things, is there something that can be done to ensure that as cities and jurisdictions are investing a truckload of money to make these positive health changes, that we're not just kind of continuing more of the same?
Yeah, so both the United States and Canada both use that NSF process for certifying plumbing materials, so that revised NSF standard would apply to materials that are for sale in Canada as well. So we did get a little win this year when they revised their leaching test to make sure that the materials leach less lead, but that process is very much dominated by the plumbing industry, of what they can do and what they want to do. I went to speak to them last year trying to encourage them to have a labeling system for items that have no added lead in them, so you can just find them on the shelf. They exist, but there's no way to identify them when you're out shopping for those. And they said, well, we don't really care about that. We think we've got it really low. If people have an issue, they can use filters. So they're willing to, buy our product, buy a filter. That's kind of their strategy there. So I think when we do bulk purchasing, when we're looking at replacing at the faucets for school districts statewide, the purchasing power at the state level could say, we want these materials and we don't want them to leach lead. We want no added lead in any of these products. And so there is a lot of power that you could have there to demand more of the plumbing industry.
Great, thank you. And Senator Peterson had to drop off, but it looks like Dr. Mona is answering the question she had posed in the chat, which is about what can pregnant women and new parents do to protect themselves from lead in water. So if you have anything else to add, Dr. Mona or Elin, go ahead and either chat it or you can answer the question now. Otherwise, we'll go to Representative Harris, and that'll be the last question so that we can move on. But we will go through the chat and make sure that all the questions were addressed. And if not, we'll reach out to the speakers and try to get answers.
Sure, thank you. I want to go back to Ann's question and Elin's comment about Indiana. So I'm in Indiana and I was one of the co-authors, and basically that's what happened is it went through the process here. It didn't start off, the original bill did not start off as 15, and that got decreased, that number got changed through the process. Also, originally childcare centers was part of the legislation here in Indiana. And so in reference to it getting passed, those things had to change, unfortunately. We did get some good things in that the bill originally started as a Lake County only, because we've had a history of lead issues here in the northwest part of the state. So the testing expanded out to the rest of the state. And our Indiana Financial, IFA, they ended up providing some funding to help out school districts. So it was a little bit of a give and take. We had some good things brought in and some bad changes happen. And then what our plan and hope is that we can get that number from 15 to go to a smaller number and hopefully make it a little bit more healthier for our kids here in Indiana. Thank you.
Well, thank you all. And please join me in thanking our speakers, Dr. Mona Hanna-Attisha and Elin Betanzo, for a very informative session that included some great actionable information for GLLC members as policymakers. I know that most of us join GLLC to get actionable information that we can take back to our districts and our states and use. But thank you both so much. Your work is inspiring, and we appreciate you taking the time to help us in our work. Thank you.
Thank you. Thank you for all of what you do. Thank you.
I also want to put in a plug for the Flint Kids Fund, which Dr. Mona founded. According to the website, which John will share in the chat, since 2016, the fund has invested over $9 million in programs aimed to address and mitigate the impact of lead poisoning and trauma suffered by many children in Flint. I encourage you all to consider a donation to the fund as a virtual service component of our virtual meeting. Now we'll convene a brief business session. We have a report from the Task Force on Lead. I mentioned earlier that GLC has a task force on lead. We'll hear the task force report from Senator Kurt Vanderwall, Michigan's representative on the executive committee and a member of the task force. Thank you, Kurt.
Thank you. Very grateful to be here and part of this this group. So my report start out. The task force has been active over the past 2 years, following the pilot test of our concept for the Great Lakes St. Lawrence Policy Institute, what we now call the Burkholz Institute, in honor of the GLLC founder, the late Senator Patty Burkholz from Michigan. Over that 2-year period, we have produced several items, of which you'll find in the briefing book for today's meeting. A policy resolution that the caucus adopted in 2018 at our annual meeting. Second, an action plan describing what we set out to do as a group and as a caucus. 3, model policies for reducing the public's exposure to lead in drinking water. And lastly, a formal comment letter providing feedback on the U.S. EPA's proposed revisions to the lead and copper rule. We're nearing the end of our 2-year work plan, which last task being to review and reflect on the ideas that the Elin Betanzo shared today, and to figure out how to incorporate those ideas into our policy recommendations. The GLLC members should watch for any changes in the model policies to be shared later this year. In 2021, even though the task force will no longer be operating, the members have committed to continuing the work to advance the model policies. What we're able to do in our respective legislative sessions will be limited by the COVID pandemic. and the fiscal constraints we're feeling at levels of the government. But we recognize this is important, health-related work, and so we'll continue our efforts to take coordinated regional action to reduce exposure to lead in drinking water. Great. The GLLC staff will collaborate with staff and the Great Lakes Commission to post on their Blue Accounting website up-to-date information on the model policies and their adoption, so we'll be able to track our collective progress that way. Finally, I want to add my thanks on behalf of the task force and the GLLC as a whole to the Joyce Foundation for supporting our work on lead, as well as our general operations. We're grateful to the foundation for recognizing the importance and helping legislators engage constructively in policy making with regard to the Great Lakes and water quality. Madam Vice Chair, this concludes my report.
Thank you, Kurt. Next, we'll hear from the GLLC Director, Lisa Hanero, for a brief report on recent developments related to the caucus and some things that GLLC members can look forward to in the coming weeks and months.
Thank you, Madam Vice Chair. Well, the caucus has had a really good year, a very busy year. Significant development was the launching of the new GLLC website. And I encourage everyone to check it out and leave us your feedback. Their comment feature is active on the site, so please let us know what you think. In addition to the executive committee, there have been several teams that were active over the past year. Senator Vanderwall just reported on the task force on lead. In addition, the task force on nutrient management, which is chaired by Wisconsin Senator Andre Jacques, they kicked off their activities last fall during the inaugural Burkholz Institute. And they've been working since then to do something similar to what the task force on lead did. First, they developed a policy statement that the GLLC passed as a resolution. Next, they put together an action plan, and there's also a set of model policies, just like the model policies on lead. The caucus now has model policies on nutrient management, and the executive committee members are reviewing the recommendation from this task force right now. And by the time of our September 21st session, the next one, we should have progress to report, and you'll hear from Senator Jacques on that. 2020, of course, is an election year, not just for the states and the federal government here in the US, but also for the caucus. And so a nominating committee organized to select a slate of candidates to become the leadership team to serve in 2021 and 2022. So GLLC members will be voting on that slate of candidates during the final virtual meeting on October 9th. And I want to thank both the members of the nominating committee and also the task force on lead, which will be wrapping up, for the service that they've provided to the caucus this current year. Following the strategic planning process in 2018, the executive committee made it a priority to build stronger working relationships with other Great Lakes organizations. So this year I've been coordinating closely with several, including the Great Lakes Commission, the Great Lakes and St. Lawrence Cities Initiative, and also the Great Lakes St. Lawrence Governors and Premiers and other organizations. And that has helped the caucus get involved with these other groups in some appropriate joint advocacy of Great Lakes related priorities, such as funding for infrastructure improvement and also for the Great Lakes Restoration Initiative. The Great Lakes Commission actually helped to organize the Burkholz Institute in 2019. And following that institute, they've been advising the task force on nutrient management. It's been a really productive and helpful relationship. Members of the task force have also been assisting the commission staff by reviewing some of the new dashboards that are being developed for Blue Accounting, so that the site can provide information that is most salient to a legislative audience. That was something that had been missing in the first iteration of Blue Accounting. The commission staff has invited the caucus to have representation, and that would be me, on a few short-term committees. One is the Standing Committee on Climate Resilience. Senator Rest from Minnesota is a commissioner, so she's also on that committee. And also I've been participating on the Conservation Kick Advisory Council that's working on developing a platform for nutrient trading. And I know the commission staff are interested in continuing to support the work of the Burkholz Institute, so I'll be inviting staff to serve on the steering committee for the 2021 Institute when it organizes later this year. Looking ahead to the next 3 virtual meetings, the dates are September 21, October 2nd, and October 9th. All starting at 9 a.m. Central and 10 a.m. Eastern. And like today's meeting, there will be a presentation on a topic that's on the caucus's policy agenda, followed by a business session. Next time during the business session, the caucus is going to be deciding on the focus for the 2021 Burkholz Institute. Members received a link to an online survey yesterday, so please make sure to fill it out so that I'll have your vote on the possible topics. Then on October 2nd, the caucus will hold the state and provincial roundtable. That's always a feature at the annual meetings. And so you'll hear from members of the executive committee about Great Lakes related and water quality related legislative activities in their jurisdictions. And finally, on October 9th, the caucus will be electing the leadership team for the coming 2-year term, and also considering resolutions. And as a reminder to members, you still have time to submit proposed resolutions for consideration. The deadline is 1 week from today, September 18th, so please make sure you send me your draft resolution so that I can get those reviewed by the executive committee. Now, I want to note that these 4 meetings collectively are taking the place of at least 8 hours of programming for an in-person meeting. And so if you do the math, it becomes apparent that it's hard to squeeze 8 hours into 4. So this session ran a little bit long, but I think that was good because the discussion, obviously people had a lot of questions. For the next 2 sessions and the third, we will be extending the time beyond the 1 hour. So plan on 75 minutes for the next 2. And because of the resolutions and the election of officers and the invitation to the 2021 meeting, the final session on October 9th will probably run 90 minutes. So please plan accordingly if you're going to be attending those sessions, and I certainly hope you will. At CSG Midwest, we value and use the feedback that we receive from people who attend our meetings. So when we're done here, please take a moment to fill out the very brief survey that you'll find linked in the chat. I'll also include the link in that follow-up message that I'm going to be sending later today when we post the video. And then finally, I want to thank my CSG coworkers, Jenny Chidlow and John Davis, who are with us today and are helping with all 4 virtual meetings. And I want to thank Tim Anderson, who will be with us next time. Tim, in addition to compiling the caucus's trackers, Tim collaborates with John and me to write the quarterly Great Lakes St. Lawrence news for legislators. And then Jenny does all kinds of amazing things, and she's the glue that holds us all together. So I'd also like to thank my boss, Mike McCabe, for the confidence he placed in me 9 years ago when he turned the caucus over to my care. I thoroughly enjoy the opportunity to work with all of you on these important issues for the Great Lakes and St. Lawrence River region, and I look forward to continuing to work with you in the future. And Madam Vice Chair, that concludes my report.
Well, thank you, Lisa, and I'm glad to hear you have some help with all this work. That was good to hear. Well, this brings us to the end of our first 2020 GLC virtual meeting. Thanks again to our speakers who were fabulous, and to our sponsor, the Joyce Foundation, and thanks to all of the GLLC members and other attendees for joining us today. We didn't know if this was going to be successful or not, but I'm sure the evaluations will show that it truly was. I hope to see you at our next meeting on September 21st at the same time, again, when our focus will be on nutrient pollution and be as equally as informative. So until then, be safe and be well. Thank you all.
Excellent job. Have a great day.